Living Well, brought to you by Christus Cabrini Hospital.
Today's Living Well talks about a topic that maybe might be challenging us a bit to live well. Dr. Ben Palumbo joins us. We're talking about allergies, seasonal allergies. We're dying.
Yes, everybody is. The pollen counts are crazy right now. I myself deal with the same issue. All the plants now are blooming. They're sending out what they need, and we can get this over response to these allergens, which are just irritants. It causes your body to release histamines, and bam, you've got itchy eyes, itchy throat, itchy skin, runny nose, stuff like that. We normally, recommend antihistamines like Zyrtec, Claritin, Allegra, Benadryl, things like that to block that histamine to help nullify that response.
Okay. What about the really serious issues? I hear folks have some really serious problems here, real serious headaches that makes their jaws hurt, makes their teeth hurt.
Some people have issues with draining, and whether it's from allergens or whether it's from the high pollen count, the mucus that you drain this stuff out with can become so thick that it's not draining anymore. And so drinking a lot of water is very important. But you can take Mucinex or something like that to help thin it out so it drains a little bit easier. Some people actually have a physical issue with draining their sinuses, and that develops into infections and stuff. And that they need to see a specialist like an ENT. There's several different procedures you can have done to open those areas up and let you drain. The headaches are just from the irritation of the sinus cavities, the tissue in there. And normally if you can clear that out, generally those headaches go away. One of the things I like to recommend is non-medicinal. It's called Neomed Sinus Rinse. It's just some saline nose spray, and you basically flush out your sinuses. It's kind of gross, but after a couple of days you feel really good because all that stuff's gone.
So really you could treat a lot of this over the counter by going to your local drugstore. At what point do we need to come to a physician and possibly get a prescription?
If you're having issues where most of the stuff now is over the counter, but if you're having issues with it not going away, or if you're starting to develop pain, discomfort, or infection, or discolored mucus, those are all signs of infection, and that may require a physician's visit for that.
For more information, call 318-448-4964.